Hello and welcome. We're all here today to learn how to provide the best possible care for our older patients. Well, of course you say that's what we do. And yes, it is what you do day after day, patient after patient. But we all know there are some days, some situations, some patients that, well, make it seem more difficult for us to give them the best possible care they need. Nowhere is this more true than with patients who come to the clinic after a recent hospitalization. These patients pose one of the most challenging and potentially time-consuming situations you face in a busy clinic, especially when there is a disconnect between the two systems, the hospital and the clinic. I want you to take away one key idea today. To provide the best possible care in a situation like the post-discharge follow-up visit, the team approach can work. Yes, interdisciplinary teamwork. But can this be done in a busy outpatient clinic? It's difficult because each of you, as a healthcare professional, can only be aware of your slice of the action. Your 2 minutes as a clerk, your 5, maybe 10 minutes as a nurse, your 15, maybe 20 minutes as a nurse practitioner, PA, doctor, or social worker. The big picture, so to speak, is out of reach. It's virtually impossible for any one of you in your short allotted time to fully grasp what is going on with your patient and the caregiver. In the first scenario, you will see a patient who's at the clinic for the typical but not ideal post-discharge visit. In the second scenario, you will see the approach we are aiming for. As you think through the many possible ways to improve on the first scenario, keep in mind 3 principles. 1, identify the red flags. 2, know your geriatric syndromes. And 3, communicate as a team in a dynamic way so that everybody knows as much as possible about the patient. Okay, it's a typical busy morning at the clinic, 11 o'clock. Jack Wilson is checking in for his appointment. The first problem, he's an hour late.
Hello, we're the Wilsons. I'm sorry we're late. We live so far away, but my husband just got out of the hospital.
We're very busy today. Just have a seat in the waiting area. I'll tell the nurse you're here.
Okay.
Rachel, line 1, patient information, keep 15. Rachel, line 1, patient information, keep 15.
Mr. Wilson just arrived an hour late. He's an overbook because he was in the hospital.
I'll have to talk to the doctor.
Yes.
Doctor, can you step out here, please? We have a situation.
I'll be out in a few minutes. I'm busy right now. Okay, what can I do for you?
We have an overbook, and he just showed up.
We're running so far behind now. See if they can come back tomorrow, or maybe next week.
I'm sorry, Mr. Wilson. It's already 11:30, and we usually finish by 12. Could you reschedule your appointment?
I guess so.
Rachel, line 1, patient information, keep 15. Rachel, line 1, patient information.
Can you help us? They said we'd have to reschedule, but we just drove 60 miles, and I'm not a very good driver. Is there any way the doctor could see us today, even sometime this afternoon?
I'm not sure. Is there a problem?
Yes, I'm afraid my husband is on the wrong medications. He's fallen since he's been home.
Let me see what I can do. Jordan, got a minute?
Sure, what's going on?
Mr. Wilson's an overbook. His wife drove 60 miles to get here. He's falling and he needs his medicine.
They should reschedule.
Tell that to his wife. She won't leave unless someone sees him.
The Wilsons. I know him. I'll see him if he doesn't mind waiting.
Great.
I have a light schedule this afternoon. Put him down as my last appointment.
Thanks, Jordan. Glad you were here. You're in luck, Mr. Wilson. Our nurse practitioner can squeeze you in at 3 o'clock. Maybe you and your wife could get some lunch in the meantime. How's that sound?
Okay.
Thank you. We'll be back before 3.
Does this scene look familiar? And the solution? Not a bad solution, having Mr. Wilson come back in the afternoon. Short of stopping all activity at the clinic that morning and making Mr. Wilson the priority for the day, is there any other way to handle this situation? Before we get to that, let's see what happens in the afternoon. They got there early, checked in, and were told to go to the waiting area. Almost a half hour later, the clerk finally let the nurse know that they were waiting. The nurse practitioner, however, was looking forward to an early day so he could catch up on his paperwork. Finally, 15 minutes after their scheduled afternoon appointment, Mr. Wilson is shown into the examination room. The nurse practitioner didn't know they had been waiting since 2:30 and assumed they were late again.
Okay, Mr. Wilson, what brings you in today?
My wife.
Well, how are you doing?
Okay.
I heard you were at the hospital.
Oh. Yeah.
What hospital were you at?
Jackson. Jackson Hospital.
Well, what happened?
I don't remember. I fell. Virginia called the ambulance.
A couple of weeks ago, he fell in the middle of the night. I couldn't pick him up off the floor, so I called 911. They took him to the nearest hospital. That's Jackson County Memorial.
I see. What happened at the hospital?
They didn't tell me.
They ran a bunch of tests, said he didn't break anything, and he hadn't had a heart attack or stroke. They said he should go to rehab, but he really wanted to come home first. So I said, okay.
How long was he there?
7 days. But I don't know what they did to him. He was worse when he got home than when he went in. And they changed a lot of his medicines. We need to get those from the VA.
All right, what do you need? They really do have you on a lot of medicines here. Do you know what they're for?
I don't remember. I just assumed he needed them all.
To tell you the truth, Mrs. Wilson, I feel a little uncomfortable giving him some of these. We don't know what they're for.
Well, he's been out of the hospital a week, and he hasn't gotten his new ones. I just wasn't sure he needed all of them. That's why I want Dr. Mitchell to see him.
Well, Dr. Mitchell is very busy. Let's go through a few of these. I know he has diabetes, but an insulin sliding scale, he's never needed insulin before. Also, why would they change all of his blood pressure meds around and add 2 new ones? We had his blood pressure under great control. This doesn't make sense.
They said his diabetes and blood pressure were out of control.
This medicine, it's a antipsychotic. Why does he need this?
He had some confusion there, and he was having difficulty staying in bed at night.
And also this drug, meclizine, also called Anavert. Does he have vertigo?
He had some dizziness there.
Mr. Wilson, do you feel dizzy now?
I don't think so.
Okay. I'll be right back. I'm going to talk to Dr. Mitchell. Oh, Dr. Mitchell.
Yes, what is it?
It's about Mr. Wilson. 82, diabetes, hypertension, maybe a little dementia going on.
I remember him. I thought he was doing pretty well. I didn't know he had dementia, though.
Well, maybe a new diagnosis from the hospital. He was at Jackson County for 7 days. I think for syncope. All I have from them is this.
What are we supposed to do with this? You know we never get good information from the hospitals. Call the hospital back and find out what's going on.
All right, but in the meantime?
How's he doing?
He looks okay. No complaints.
Give him a 2-week supply of meds and have him come back before then.
Will do.
Good.
I talked to Dr. Mitchell. We'll order these new meds for you, just a couple weeks supply. We'll have our clerk get the discharge summary so we can figure this out. If you have any problems, just give me or Dr. Mitchell a call. Sound okay?
Okay.
I guess so. But what if we can't make it back in 2 weeks? I can't always drive him.
Tell you what, talk to our social worker. She should still be in her office and can help you.
All right. Thank you.
How did that feel? On the one hand, everyone did their job, and even a bit more than expected by squeezing Mr. Wilson into the afternoon clinic. But perhaps you felt the same way the clerk, the nurse practitioner felt, that something was not right with the Wilsons. But what could they do? They didn't create the many problems they're now having to deal with because of the recent hospitalization and because of the disconnect between the hospital and the clinic. And in fact, nothing physically seems wrong with Mr. Wilson. The nurse practitioner even noted he has no complaints. But let's start by asking, did you catch the red flags? The transportation issue, the wife saying, "We are not doing well," how slowly they both moved to the waiting area, how Mr. Wilson answered, "I don't know," or how short his answers were, which might signify depression. The fact that he fell again since being home. The dizziness the last couple of days in the hospital, probably the time they started getting him out of the bed. And the confusion in the hospital, that is the delirium, which is often not recognized, but rather just treated with an antipsychotic. And of course, all the new medications. Well, you can guess what might happen to him over the next couple of weeks. He may have side effects to these new medicines. He will likely keep falling. He even has a good chance of ending up back in the hospital. And what could happen to his wife, who is burdened with caring for a man who is probably becoming more dependent on her as the weeks go by? Now, let's rewind here and watch what happens when the healthcare professionals start to identify the red flags in a proactive way, and when they focus on the geriatric syndromes, and when they communicate as a team in a dynamic way so that everybody knows as much as possible about the patient. Same scenario, same people, still a busy clinic. It's 11 o'clock again.
Hello, we're the Wilsons. I'm sorry we're late, but we live so far away. My husband just got out of the hospital.
What hospital were you at?
Jackson County Memorial Hospital.
Who was your doctor?
Oh, we had so many, but I think the main one was Dr. Harani.
Did he give you any paperwork?
Oh, yes, only this.
Mr. Wilson, I need you to sign this just in case we need any records from the hospital.
Okay.
We're very busy today. Just have a seat in the waiting area and I'll tell the nurse you are here.
Thank you.
Rachel Line 150, station 2001, Rachel.
Mr. Wilson just arrived an hour late.
I'll have to talk to the doctor.
Well, I think there are a few red flags. He's an overbook because he just got out of the hospital.
All right.
And they were late. His wife said it was because they live so far away. Also, he and his wife were sure moving slowly.
Anything else?
Yeah, they gave me this from the hospital.
All right. I'll ask the doctor.
Yes.
Dr. Mitchell, can I ask you something?
Yeah, sure. What is it?
Can you step out here, please? We have a situation.
I'll be right out just as soon as I finish.
Line 150, station 15, Rachel Line 150, information.
Okay, what can I do for you?
Sir, we have an overbook, and he just showed up.
We're running so far behind now. See if they can come back tomorrow or maybe next week.
There may be some problems, Doctor.
What do you mean?
The clerk said he was an overbook because he just came from the hospital. They were both moving more slowly than usual, and they brought this in.
Wow. You do have him on a lot of meds. Okay, let's do this. Check him in after you check in all the other patients for the morning.
All right.
And spend a few extra minutes with him. Get some more information, okay? Especially, cover a few of these if you have the time. Talk to his wife. Find out if he's really taking all these meds. And ask her about his cognitive function. Let me know if you think she's experiencing any caregiver burden.
Okay.
Oh, Michelle, make sure you check him for orthostatic hypotension, too.
I'll take care of it. And then what's next?
Have the clerk get a signed release of information and get the discharge summary from the hospital. Then you can reschedule Mr. Wilson for this afternoon, either with me or the nurse practitioner.
Very good.
Oh, and have them talk to the social worker between now and then if you can.
I'll take care of it.
Thanks.
Jordan, there's a Mr. Wilson who might be on your schedule this afternoon. If he is, make sure we talk. I've got some red flags you need to know about. Colleen, please reschedule Mr. Wilson for this afternoon, either for Dr. Mitchell or for Jordan. Tell them I'll check in with them as soon as I'm done with my other patients.
Sure, we'll do.
And get a signed release of information form from them and a discharge summary from the hospital.
Consider it done.
Thanks.
Much better, right? Why? Because the healthcare professionals recognized some red flags, such as polypharmacy, transportation issues, caregiver burden, right up front. Then there was a focus on the present and the potential geriatric syndromes. Lastly, they took the team approach to handling the situation. Now, let's see what happens this afternoon.
I'm sorry, Mr. Wilson, we've been so busy this afternoon. We usually finish by 12 and it's already 11:45. Did the clerk set you up for an appointment this afternoon?
I guess so.
Yes, at 3 o'clock with Jordan Perry, the nurse practitioner.
Good. So, Mr. Wilson, how have you been doing since coming home from the hospital?
Okay.
Any new problems?
No.
And how about you, Mrs. Wilson? How have things been going?
Well, he's fallen again since he's been home, and he's so much weaker.
Anything he can't do now that he used to?
Well, he needs help just walking around the house and getting out of a chair. I even have to help him dress sometimes.
All right, 132/78. That's pretty good blood pressure. Any problems with his bladder?
Yes, as a matter of fact.
Mr. Wilson, I'm going to have you stand up for me now. I'm going to check your blood pressure standing.
Oh, okay.
Stand up for just a minute. All right, that's good. All right, you can sit down. 105/60. It dropped quite a bit. Do you take a lot of medicines for your blood pressure?
I don't know.
Is he taking all these meds?
Actually, no. That's why he's here. He hasn't taken any new medications, only his old ones.
Mr. Wilson, I have to ask your wife one more question, okay?
Okay.
How's his thinking been since he came home?
I'm so glad you asked. In the hospital, he was confused and disoriented. I thought maybe he was developing Alzheimer's or something, but now his confusion is better.
That's good.
But he seems so down. I think that's been coming on for some time now.
Are you feeling depressed?
I don't know. Maybe.
Okay. Thank you. Look, why don't you both go get some lunch, then come back and check in with me? I'll see if I can get you an appointment with a social worker before you see the nurse practitioner.
All right. But could you help me get him to the bathroom first?
Sure.
Notice how the nurse made every effort not to ignore Mr. Wilson while still being able to pick up on the red flags in the geriatric syndromes. No patient likes to be ignored, but especially one who is having several problems. Also, one red flag was mentioned that I want to emphasize: depression. Depression is very tricky. It can mask a lot of things, so we need to screen for depression. Let's continue on, keeping in mind the three principles. 1, identifying the red flags. 2, knowing your geriatric syndromes. And 3, communicating as a team in a dynamic way. To make the system work for the patient and for us, the healthcare professionals, we need the team approach. It can start with any one of you.
Colleen, did you reschedule Mr. Wilson for this afternoon?
Sure did with Jordan at 3.
Good. Jordan, I'm going to be helping you on this. Apparently he's got quite a few red flag issues going on. Colleen and Michelle picked up on them. These are the geriatric syndromes that usually come up. Which do you think apply to the Wilsons?
His wife now helps him out of the chair. She helps him walk around the house sometimes. She helps him dress. We need to address polypharmacy. He sounds like he had delirium at the hospital. I'm not sure if he has dementia, but I'm pretty sure he's depressed. He's fallen at least once since he's been at home. He's incontinent of urine. I didn't ask about bowels. His wife definitely feels caregiver burden, and he has orthostatic hypotension.
Thank you. Colleen.
Transportation seems like an issue. They live 60 miles away. Also, here's the reconciliation sheet from the hospital. And the hospital just faxed this. It's a discharge summary. There you go.
Thank you. I'll call the doctor there to clarify a few things. Jordan, I'm going to need to talk to you before we see them, okay?
Sounds good. At that time, should we get the social worker involved?
I've already got him set up to see her at 1:30. I want her to see how Mrs. Wilson is doing. I think it's so important in this situation. The Wilsons seem to have a lot of issues that require a social worker.
Excellent idea. We need to take care of Mrs. Wilson, too. I see. You worked him up for cardiac and neurological causes of syncope, but everything was negative. Did you figure out why he was falling at home? I thought it was debility, getting weaker at home. Jordan, I spoke with the doc and took care of Mr. Wilson.
What'd you learn?
The syncope workup for his falls was negative, as it usually is. It seems like he was dehydrated on the mission, had delirium while he was there, and then on the last day something happened. He went home instead of going to rehab.
That's too bad.
Now, based on this and what Michelle and Colleen said, I make sure to order home care, nursing for med management, PTOT because of his ADL loss and falls. And make sure he's not still delirious. I like using the confusion assessment method for this.
Will do.
Now, if he's not delirious, I'd like to do a slumps and a GDS today. Look back and check on his labs, too. I'd also check to see if he's been losing weight. Awfully suspicious he's been depressed, and we may need to treat it.
Depression could explain why he may not have been eating and drinking well at home. That's why he became dehydrated.
And that led to some of the falls.
What about the long med list?
Don't order the insulin sliding scale. That was just for the hospital. And don't order the new cardiac BP meds, or the meclizine or the antipsychotic.
What about the old meds?
Well, if his blood pressure is really as low as Michelle got, then stop his thiazide diuretic and cut his ACE inhibitor in half. Oh, and if they have the time, have them stop by the pharmacy to discuss these meds with the pharmacist. They especially need to know what these meds are for.
Okay.
And have the pharmacist call us if there's any worrisome interactions.
Not a problem. I'll take care of it.
The Wilsons and all of our patients and caregivers deserve the very best care we can give them. There are a lot of bases to cover, from the time they check in, throughout the varied procedures and tests and exams that must be administered, and the follow-ups to make sure both the patient and the caregiver are taken care of. It falls on each healthcare professional to stay connected to everyone else on the team. None of you can solve the myriad of challenges by yourself, but when you use the team approach, even in a busy outpatient clinic, you can accomplish wonders. You'll help Mr. and Mrs. Wilson not only on the day they show up at the clinic, but every day down the road.